Hi everyone, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about the healthcare exchange insurances or the marketplace insurances. This used to be referred to as Obamacare insurances, and with the presidential election coming up, there's a lot of discussion on this topic about the Affordable Care Act, which is also known as Obamacare, and everything like that. And I can tell you from working in healthcare since 2010, when the Affordable Care Act went into place, there have been definite positives to it. But there's also been a lot of negatives, and especially for small private practices. Now, there could also be negatives for the big groups, the big organizations, the hospital systems, stuff like that. I'm sure there have been. But because I've never worked in any of those organizations, I can't speak on behalf of that. But I can speak firsthand about how it has been good and bad for the small private practices throughout the country. I can tell you some of the pros are, the no pre-existing conditions issue. Like nobody is getting denied insurance. I can tell you that all children being able to have insurance for dental and medical and all that covered is fantastic. I can also tell you that the positives of people knowing where to go to get insurance if they don't qualify for Medicaid in their state is also nice because it gives them a little bit more options. There are definitely, like I said, some positives. Oh, the other one that I really am supportive of is the incentive to not have to pay out of pocket when you get screenings done, like preventive stuff. Like they want people to be proactive in their health. So the physicals, you don't have to pay copays. It doesn't go towards your deductible. Any kind of like mammograms, colonoscopies. I mean, there's some catches there because if they end up finding something that's suspicious and they have to do additional testing, it goes from screening to diagnostic, and then it comes from out of pocket. So there's some things that aren't so good about it, but overall, it's really good to encourage people to at least go to the doctor once a year to get your physical, right, and make sure things are going okay. So those are the positives. The negatives is it's very difficult for private small practices to be able to get contracted with a lot of these plans that are on the marketplace. The other things is it is costing consumers in general, and I'm sure you know this, a lot more money for your own premiums, because what the insurance companies did is like, okay, if we're giving discounts to these people who don't qualify for Medicaid because their income's too high, but they are in such a situation that they need insurance, but either they can't get it through their employer or they maybe aren't working, but they have some kind of income that keeps them from getting Medicaid, they're getting kind of like a discounted insurance plan. And sometimes, there's some federal like reimbursement or help that they'll give them. It's not Medicaid, but they'll help them pay towards their premiums and stuff. And so because of this, because the insurances are kind of like having to cover more people, they're covering people with pre-existing conditions that are more sick. So it's more out of pocket for the insurance companies because they're giving discounts on certain things because they're required through the Affordable Care Act to offer so many plans for certain amounts of money. I don't know all the details. I just know these details. They're passing on that extra expenditure that's coming out of their pocket to all of us and to employers who offer the insurances to their employees. So although it sounds really good that it's discounted for people, that cost has to come, that money has to come from somewhere, right? So it's coming from everybody else to help make up that. So that's why I'm sure you've seen a huge rise in your premiums, your deductibles, co-insurance responsibilities. It's because there has to be money somewhere. Plus, taxes went up to help cover the amount that the federal government is contributing to these plans. And so if you look at it all from there, it's like, whew, okay, as a consumer, that's hard. And then if you're in a small private practice, it makes it even harder because you can't even accept and see a lot of these patients with these insurances. So what's really disheartening for people who are in internal medicine, primary care, pediatrics, not so much probably pediatrics, but the other ones, is if you had a patient who falls on hard times or they have to get insurance through the marketplace, there's a very good possibility that they won't be able to see you anymore. So that's money out of your pocket for a patient who has seen you forever. And it breaks their heart too, because you have a rapport with them, you know their background, their history, and that helps with their overall care. So that's another downside. But it's one of those things where it seems like when you get your contracts with Cigna's, Aetna's, Blue Cross Blue Shield, in my area it's Providence, Moda, they're like the regional plans. If you're a small private practice, those contracts are not going to include the marketplace. And you're not going to realize that until you try to see a patient with a plan through the marketplace that you don't even know is a plan through the marketplace, because you're just checking. You're like, oh, Providence, we take Providence. Oh, Blue Cross, yeah, we take that. And you see the patient and you bill out the claim and it comes back denied saying, they need an authorization or a referral to be able to see you. And you're like, well, I didn't get that. Will you give it to me now? No, we don't do retro auths or referrals. Okay, why can't I see them? Because I have a contract with you. Oh, but this is a carve out. This is a marketplace plan. You're not covered for the marketplace plans. Okay, well, I want to become covered for the marketplace plans. Oh, sorry, we're not doing any new providers. We're not accepting any new groups. And then you look into it further and you see the big health groups in your area, the big organizations, the hospital affiliated type groups. They're the only ones that can accept these insurances. And not only did you see a patient basically for free, because that's kind of your fault, right? For not checking, even though it wasn't your fault, because who would have thought? And you probably didn't read the contract or understand the contract, or it didn't mention in the contract which plans were excluded. And you probably didn't ask because you're new to it and you didn't think about it, which is totally understandable. And so now you're out that money, you're out a patient that you thought would maybe be reoccurring to have that revenue. And you can't even get on the plan to be able to see these patients. And it's very disheartening and it's very frustrating. And my heart is with private practices, and I don't think it's fair, but it is what it is. And so, a lot of ways that you can identify these plans, though, I am learning very quickly, is they have some kind of metal in their plan name: bronze, silver, gold, platinum. They have some kind of metal name. So if you have a patient that says they have Cigna or Aetna or Blue Cross Blue Shield, and you look at their card and the plan says silver something or something something silver or bronze blah blah blah, that's a good indicator. You need to look a little bit further to see if that's really a plan that you take. And the only way you're going to know is if you log into that insurance's portal and you look up that patient and you look to see if it says marketplace or health insurance exchange. It's used interchangeably, to see if that's a plan. And then you would need to see if your tax ID and MPI number are covered. If you can't find that information, I would be calling. I highly recommend calling and saying, hey, we have a patient with this plan. I am not familiar with it, or I'm curious if we're participating, and they can look it up and tell you. But if you're not catching on to this soon enough and you keep seeing like a patient, like physical therapy, you see this patient like 3 times a week, and it's not until like the third time or third week that you have been seeing them, so 9 visits total, that a claim comes back from the first time you saw them and says denied, you've seen that person 9 times that now are not going to get paid. That's huge. And so that's where I find a lot of things need to be considered and thought about as a consumer, but also as a business owner, a provider, a manager of a healthcare practice, among all the other pieces to the Obamacare, healthcare, Affordable Healthcare Act, stuff like that, is yes, there's a lot of good, but there's also a lot of cons. And sometimes the cons, in my opinion, kind of almost outweigh some of the pros as a business person, right? As a business person in a small practice trying to see patients and stay, financially in the black, you're going, oh my gosh, this is making it so challenging. On top of like the whole, qualifications to make sure that you're doing everything you need to with MACRA and MIPS for Medicare. And a lot of the other commercial insurances have their own quality checks and stuff that you have to do depending on your specialty. And all that stuff came in with Obamacare. And it's like administrative burden, time from your staff. You're paying them to do all this research when it shouldn't be this hard, but you don't want to see patients that you're not going to get paid for. And you don't want to upset patients, but at the same time, you have to be very honest with them why you can't see them anymore if they're established. And a lot of times they get really mad, but they can't change their insurance for a year. So it's just, it can be really, really disheartening in a lot of ways. And I just want to bring awareness to that. One, because it's a big topic right now and things to consider. But two, if you're a private practice and you're getting contracts right now and you've worked on credentialing and contracting, check with your payers. If they have insurance plans on the healthcare exchange, you can go to health.gov, I think is the it's healthsomething.gov, but you can just Google healthcare marketplace. You can put in your zip code and you should be able to see plans in your area, and it will tell you the different companies that hold them. And if you see companies in your area that have plans, I would be calling your rep or calling customer service, credentialing, contracting, and saying, hey, I see there's marketplace plans in my area. Am I participating with them in my contract? And if they say no, can you send me a list of which ones I'm not participating? So then you can give it to your front office to be able to start screening those patients' plans when they're scheduling them, scanning in their cards to double check and make sure you're not seeing patients that you shouldn't. And just so you know, right now, open enrollment for 2025 insurances is starts November 1st. So it's like November 1st through January 15th is open enrollment. So this is when people can change the plan they're on right now if they're already on one, if they need to get on a plan and they didn't have like some kind of life event that allowed them to change or get on it sooner, then this coming up in a few weeks is the time. So November 1st to January 15th, if you're facing this situation, let your patients know that have this, that are maybe paying out of pocket until they can change. Let them know that it's November 1st through January 15th open enrollment. And the website's very friendly. You can go on, you can see the plans in your zip code area. You can put in doctors' names or groups, organizations to see if they're participating or not. So they've made it a lot more friendly than it used to be, which is great. But just some things to really keep in mind just to bring awareness. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful, and subscribe to my channel if you haven't already. As always, please share this with your professional colleagues who you feel would benefit. Have a good one. We'll talk to you soon. Bye-bye.